Live now to CAMH, where mayoral
Week,
candidate Mitzie Hunter is announcing her strategy to combat mental health and addiction issues here in our city. Let's listen in live.
Children's Mental Health Week. And there's no better time for us to have a frank discussion about mental health and addictions. I am so pleased that I'm joined here today by Dr. Sylvain Roy, as well as Annalie Bonda, both of whom have been working on my mental health strategy. During this campaign, I have been in regular conversations with people who are experiencing mental health issues and challenges, and I've been talking about mental wellness and the role that addictions, substance abuse, and related issues have on homelessness. It is a crisis. We all know it. Maybe it is someone in your family, someone at work. Maybe it is a neighbor. Maybe it is someone in the park or on the TTC. I've been listening, and as mayor, I will continue to actively listen on how our city can be better supporting everyone's mental health, because mental health is health. And that is why, as part of Mental Health Week, I am announcing my 5-point plan to address mental health and addictions crisis. 1, hiring a chief mental health officer. 2, relaunching Toronto's mental health support strategy. 3, creating a long-term, comprehensive mental health and addiction strategy and supporting the Toronto Board of Health's work in this area. 4, increasing the Community Service Partnerships Program Fund. 5, creating a technology fund to modernize the integration of city and provincial mental health and addiction services. The cost of the plan is $5 million. It is part of my fully costed comprehensive budget plan, which will be issued before voting begins in June. This announcement builds on my previous already announced homelessness and youth mental wellness plan. My plan helps the city's most vulnerable, persons experiencing mental illness and those struggling with substance abuse challenges. It's part of making sure our programs and our services, evidence-based, collaborative in nature, and focused on recovery. That is about our family, our friends, our neighbors, our young people. Everyone knows someone who has been touched by this. A family friend of mine fell victim to this about 3 years ago. He was an incredible young man in his late 20s, had a job, and he lived alone. And suddenly, we lost him because he took his own life. And you know, no one talked about it. And this is something that we have to address when it comes to the stigma around mental health. If people need help, they have to know that it is there for them. And I would urge anyone who needs help to call 211, Kids Help Phone. They could also text 686868 or text home. Mental health and addictions. There is no more moral imperative than we must take action and take action now. Mental health is health. As mayor, I will take action. I will not wait. I will not throw up my hands and say that it can't be done. It can be done. It must be done. Leadership gets it done. I bring fresh eyes and new solutions to do something meaningful for our people experiencing mental illness and suffering from substance abuse and addictions. And that is why I am running for mayor. I'm happy to take your questions.
Would you mind going into a little bit more detail of the roles and responsibility of the Chief Mental Health Officer?
Absolutely. You know, mental health is not a primary function of our public health unit at this time. That is a provincial responsibility in terms of the medical support and the medical response that is needed. The bottom line is that we need to do better and we need to do more. During the pandemic, we know that incidences of mental health have gone way up. We know that there has been isolation amongst individuals and that people need help. They need help and support. And so the Chief Mental Health Officer will report to our Medical Officer of Health and would be part of that group in our city to develop the responses, to advise the mayor and council about responses that we need. You know, this is something that is at a crisis point in our city. It affects seniors, it affects young people, and so we have to do more, we have to do better, and we need to develop that capability within our public health unit, and we need to also coordinate care and response with the province mainly, who has the responsibility for health.
When you touch on creating a technology fund and modernizing integration, what specifically does that mean in terms of like the technological side?
Yeah, and you know, the reality is a lot of the processes that are happening in response are done manually. You know, if someone needs help and support, we have to seek out where that support exists within the system. And technology can help to coordinate that much more efficiently and much more effectively. And so this technology fund will help to coordinate across jurisdictions, across areas with the health systems, with hospitals. We could, you know, even do that with in the justice area as well. And so that's something that I would look to implement, becoming much more efficient at providing service and access to information. It also can happen 24 hours a day because people who are in need of help and support, we don't know when that's going to be needed. And so having the right technology to coordinate across services, to coordinate across jurisdictions is something that will make it much more efficient and responsive. And you know, there is oftentimes an immediacy and an urgency to the information. It would also relieve some pressure from our emergency departments as well if those that are supporting out in the community have access to that information more readily.
All right, we've been listening into mayoral candidate Mitzie Hunter's mental health and addictions issues strategy. She says it's going to cost $5 million. She has a 5-point plan, and that includes hiring a chief mental health officer.